Hi, I'm Chris Van Hollen, and I'm proud to represent Maryland in the United States Senate. And I'm especially pleased to be joining all of you for this year's BioHealth Capital Region Forum. BioHealth Capital Region is an engine for cutting-edge life sciences and biotechnology research and innovation across Maryland and the entire DMV area, producing discoveries that not only benefit our country, but the entire world. We are deeply grateful for the extraordinary contributions that Maryland's researchers and scientists make to our well-being and to our health every day. And across the board, Maryland is home to one of the largest biopharma communities in the country, including more than 1,800 life science companies, over 70 federal labs, and world-class academic and research institutions. We have many of these organizations to thank for the progress we've made in developing new vaccines and therapeutics to fight COVID-19 at a lightning-fast pace. And it's imperative that we leverage the full force of that power as we band together to make a quantum leap forward in scientific research and sharpen our nation's competitive edge against foreign adversaries, including China. We have the institutions, we have the brainpower, and we have the resources to do just that if we put our minds to it. We can't afford to waste that wealth of potential and be eclipsed by our competitors in the process. It's time for a new golden age in American research and American innovation, and I'm proud to have worked with my colleagues in the Senate earlier this year to jumpstart that mission through our work on the United States Innovation and Competition Act of 2021, which I was pleased to co-sponsor and which passed the Senate on a bipartisan basis. That legislation includes a number of provisions I've authored and co-sponsored to invest in research and development, including the National Strategy to Ensure American Leadership Act, otherwise known as the National SEAL Act, which directs the National Academies of Science, Engineering, and Medicine to identify the 10 most critical emerging science and technology challenges facing the United States. It includes the Supporting Early Career Researchers Act to help college and university researchers, and the Research Investment to Spark the Economy Act to ensure that research that was disrupted by COVID-19 can carry on full steam ahead. That bill would also more than double the budget authorization for the National Science Foundation, from $8.5 billion to $21.3 billion over 5 years. And the bill provides an additional $29 billion over 4 years to establish a new technology directorate at NSF that would be charged with exploring new technological frontiers like AI, high-performance computing, robotics, cybersecurity, and biotechnology. When it comes to technology, standing still means falling behind. And there's no question that this bipartisan legislation will help boost innovation and grow jobs in Maryland, this region, and across the country, while also meeting the challenge of China and other competitors. And as a member of the Senate Appropriations Committee, I've been pushing to prioritize funding that will directly benefit the institutions at the forefront of advancing research in science, technology, and medicine. So far, the Senate Appropriations Committee has marked up only 3 of our total of 12 appropriations bills, and I'll be working with my colleagues this month to iron out the details on the remaining 9. But the funding numbers coming over from the House of Representatives already look promising. In the House, NIH has been set at $49.4 billion, an increase of $6.5 billion from last year. And the House has moved forward with a down payment of $3 billion for the proposed Advanced Research Projects Agency for Health, or ARPA-H, which would drive transformational research on diseases like cancer and Alzheimer's and others. And after being part of a bipartisan group that met at the White House with the president earlier this year to discuss ARPA-H, I've been in talks with folks at the White House and NIH on how we can accelerate the push to cure those devastating diseases that tear our communities. And a key avenue toward achieving that goal is through ARPA-H. The House has also set appropriations for the EDA at $433 million, which is equal to the president's budget request, and includes an $87 million increase from last year. Meanwhile, I'm collaborating with colleagues on the Senate Budget Committee to include a $40.25 billion in our Build Back Better budget to help meet research infrastructure needs at NIST and other federal science agencies. These investments and others are vital to advancing our shared mission of enhancing America's ability to be at the cutting edge of research and development. It's a mission deeply rooted in our national character. Our history has been marked and made by men and women who had the imagination and the vision to innovate, and in doing so, change the world. It's our responsibility to carry that torch forward and harness the power of American research, development, and innovation. The steps I've outlined today will help set us on that course, and I'm proud to count you as full partners in the push toward those new frontiers. And this region, Maryland and the DMV, can be at the heart of that. It's in that spirit I'd like to end where I began, by thanking all of you at the BioHealth Capital Region for your partnership, and I wish you a very successful conference. Take care.
Hello, my name is Brian Darmody, CEO of AURP, a nonprofit association of research parks and innovation districts sponsored by universities, hospital systems, federal labs, and communities in 42 states and 12 countries. Our DC area office is in the University of Maryland Discovery District in College Park, where I am broadcasting from. And I'm pleased to note that the AURP BioHealth Caucus is co-chaired by Rich Bendis of BHI, who you heard from earlier today. And our largest cluster of AURP members happens to be in the DMV, stretching from UMB Biopark up north to Richmond and the VCU Bio plus Tech Park. I want to thank Senator Chris Van Hollen from Maryland for sharing his update on bio investments supported by Congress. I know that Senator Van Hollen's very busy, so we greatly appreciate his taking time to give us an update on what's happening on the Senate side in Congress. This audience in particular knows that the bio industry is undergoing tremendous growth with new technologies, diagnoses, therapies, that are all spurring investment in basic and applied bio research and development. Rich Bendis and I wrote an article in the Journal of Commercial Biotechnology tracing the public policy initiatives that help the bio industry grow, from the founding of land-grant universities to the founding of NIH and Bethesda. Now the federal government is exploring new ways to deploy applied research and development funds and create new biohubs across the country and make the United States more technology competitive. Tomorrow, a panel will discuss where we will construct all these new bio research facilities and bio manufacturing across the DMV. And that panel will be moderated by Amy Adams of George Mason University, an AURP member. Also tomorrow, you will hear about how our region is poised to house a new global pandemic research center. But today we're going to explore the ways the federal government will stimulate more research and development in the DMV and across the country. A lot is happening on Capitol Hill, but a lot has happened already in our federal research agencies. We are fortunate to have on our panel representatives from NIH, BARDA, and a leading government relations firm that is helping keep universities, states, and other clients up to date on what is happening in the halls of Congress and the office of the White House. So I'm going to introduce our first panelist, Justin. We will start with you. Justin Yang from BARDA. Can you tell us a little bit about yourself, Justin, what BARDA stands for, and what a catalyst officer does? Because I think that's a pretty interesting role you have at BARDA.
Great, thanks Brian for the time, and thank you for the panel conveners for inviting me to this panel for a very important topic. So my name is Justin Yang. I'm the director of the Drive Division of Research, Innovation, and Ventures Catalyst Office in the Biomedical Advanced Research and Development Authority, BARDA, under the Assistant Secretary for Preparedness and Response, ASPR. So we are an authority that's under the Health and Human Services, and Matt, one of my colleagues, coordinate routinely and regularly. In my office, we're charged with three main things. It's focused on spurring innovation in the life science and biotechnology community, not just here in the DMV, but also around the country and around the world, through through these activities, such as the Drive Accelerator Network, which is an accelerator network comprised of 13 members geographically dispersed across the nation, as well as the BARDA Ventures Program, which is the first of its kind at HHS, which is an equity financing model that is different from grants, contracts, and other non-dilutive activities. Why is this important? Frankly, it's important because we want to signal a demand to industry that there are ways that the federal government can flexibly partner with you if you have an interesting and innovative technology that can provide a solution for us, as well as going after a commercial indication. So in essence, as we've always done here at BARDA, we create partnerships with the best and brightest and advanced technologies together to solve both a federal need as well as a commercial need as well.
So Justin, how does somebody get BARDA funding? Is there an application process like there is for R1 grants at NIH? What's the application process?
Yep, just like any other federal agency, we do federal funding utilizing the broad agency announcement. So broad agency announcements, or BAAs, are known as a rolling application cycle with all of our various areas of interest that are outlined. Our website is www.medicalcountermeasures.gov, as well as you can go on FedBizOps and just type in BARDA. Right now, we have 2 BAAs that are open. One is focused on the advanced research and development side, which in government speak, if the audience knows, technology readiness levels, is really meant to be this post-phase 1, phase 2 and beyond kind of vehicle. So ideally, if things go well, my NIH colleagues will support the development of the early stage, and then transitions will occur into the later stage such that we can get you through commercialization. As our name says, BARDA, which is Advanced Research and Development. We do also, in 2016, receive legislation under the 21st Century Cures Act that authorized BARDA to look at a hyper-focused way of driving innovation to the clinic and to the people. And we stood up this new division that I work in now. We do have an easy broad agency announcement, BAA as well, that's open today. We have various topics ranging from biosensors and digital health all the way to a topic called solving sepsis, which is looking at solutions towards sepsis. So yeah, various opportunities all available on the website.
So I know one of our AURP members is Children's National, building their innovation campus in the former Walter Reed campus in Northwest Washington. And I know BARDA has an office there. Can you talk a little bit about, and that's pretty unique to have a federal agency there in our innovation campus. So can you talk a little bit about how that developed and what happens there with that office?
Yeah, I mean, so this is also under my office. Great question. We partnered with Johnson & Johnson, Janssen, to create this partnership called Blue Knight. And Blue Knight is a partnership between J&J, J-Labs in DC, and BARDA to create an innovation kind of campus focused around the idea of incubation and residency. So BARDA's partnership, which is a multi-year partnership with Johnson & Johnson, is focused on allowing companies specific slots, such as lab space as well, office space, and programming that J-Labs has if you are working on a health security or if you're working on a solution that both fits the J&J family mission space as well as the BARDA mission space. So today you can apply for J-Labs in DC. We have slots available, and this is meant to be 1 to 2 year residencies that are free of charge for innovators that are working on a solution that BARDA cares about.
Great. Okay, so we're going to come back. We'll have a general discussion, but now I want to move on to Matt McMahon from NIH, head of the SEED office. So Matt, can you tell us a little bit about yourself and what the seed office does, because I think many of us are familiar with NIH, but the seed office, I think maybe a new concept to us. So tell us a little bit about seed and your role there at NIH.
Sure, great. Thanks for having me, Brian. Really appreciate the opportunity to talk a little bit about seed and what NIH is doing. My name is Matt McMahon, and I'm the director of the seed office at NIH. Seed is a relatively new office. It's been around at NIH for less than 2 years. It's a trans NIH coordinating office. So we sit within the office of the director at NIH. SEED is an acronym. It stands for Small Business Education and Entrepreneurial Development, but it also stands alone as a word because it pretty effectively describes the area where we're working in. So the mission of the SEED office is really to help NIH-funded investigators transition more of the basic science research that is funded through NIH into early stage commercial development, into early stage product development, and to provide them with programs and services and support to help them make that jump. So the SEED office was formed to coordinate a few different programmatic activities. One thing that we do is we manage a nationwide network of proof of concept centers that contains over 100 institutions across the country. And that proof of concept center provides those centers provide academic investigators with money to do early stage product development work and provides them with expertise and resources from real industry savvy advisors and folks in their local ecosystem. And also provides input and feedback from many of our federal partners like FDA and CMS and USPTO that really help these investigators de-risk the business case in addition to de-risking the scientific and technical case of their early stage products. So that's one piece in the academic space. And then we also coordinate the small business program across all of the different components of NIH. And many people have heard of the small business program, the SBIR and STTR programs. And at NIH, we're giving away $1.2 billion every year in completely non-dilutive funding to small businesses across the country. So people think of us as a government agency, but that $1.2 billion program really makes us the largest early stage seed investor in the world. So you can think of us as an investor, but we're the best kind of investor because not only do we give you money and assistance, but we take no equity as a result of providing that assistance. So that kind of encapsulates the mission of our office and some of the programmatic components of what we handle.
Yeah, it's interesting. I mean, we have BARDA, which is taking an equity interest. So it's and I think that's one of the few government agencies. In-Q-Tel may be one with the CIA, but I think BARDA is an interesting experiment. But Matt, I mean, what the SEED office, helping coordinate all those various activities and having a stronger face for NIH external research and its role in helping create new businesses and technologies is great. I think with the increase in NIH funding, which of course translates into more SBIR funding and STTR funding, I think there's going to be a lot of opportunities for greater engagement. So with that, we're going to come back and talk a little bit more collectively, but I want to move on to Leslie Gilbert from Van Soyek. There is a lot of interest, and you're seeing some of the early examples with the SEED office and BARDA in more translational research and helping the United States become more competitive. If you watched any of the discussion around what was then called the Endless Frontiers Act, which has been incorporated into the US Innovation and Competition Act, there's bipartisan interest in helping make the US more competitive compared to other countries. And one technique is to increase the amount of funding going for applied research programs, such as what we've heard from BARDA and the SEED program. So Leslie, I want to I want you to give us a quick overview of what's happening, if you can, in just a couple of minutes, what's happening on the legislative side with more funding for applied research, whether it's the NSF Directorate, Endless Frontiers, USICA, or all of these other initiatives. So.
Thank you, Brian, and thank you for having me on today. You're absolutely correct. I think as members of Congress have seen rising competition in the global space, they have really wanted to focus more on translating lab-based science into commercialization and in applied ventures. So you saw this most prominently in the authorization bill, the US ICA or USICA package that puts $81 billion toward NSF, but quite a bit of that, in fact, over 29 billion sort of dedicated to technology areas and technology specific innovation. The House of Representatives has taken a slightly different tactic on that authorization, but nevertheless does also authorize these technology hubs at the Department of Commerce that many people are talking about these days, as well as additional resources at the National Science Foundation for technology innovation and commercialization. So it isn't just a Senate or just a House type of endeavor, but both, and as you mentioned, very much bipartisan and bicameral. To answer your question, which is what is happening on this front as well as on the funding front, because as you and the audience probably well recognize, the USICA package, or in the House, the NSF for the Future package, are authorizations. They don't come necessarily, unless there's some sort of a mandatory spend embedded in them, with funding directly. So what is happening right now is that Congress is attempting to pass an agreed upon text, we're just called a USICA package, but that is going to have to take a back seat for the immediate future, because there are a number of other what we call must-pass bills and legislation that are taking precedence in the September timeframe. So I would not expect to see this authorization across the finish line in the September timeframe, although there is a lot of desire to do this before the end of the year. So I do think that we will see a package by the end of December, but it may get attached to a larger thing that's moving that also addresses broader kinds of research and innovation. One of the ways in which the leaders of the USICA package, as well as the key committees, are trying to move the ball forward in advance of this authorization is through this budget reconciliation package that many of you may have heard of, that's happening right now in Congress, where they're beginning to draft individual pieces of legislation for this budget reconciliation package. This is a very large package, which has many things not related to USICA, but it is a way that they're trying to put some direct funds into many of the ideas were encapsulated in the USICA package. The problem with that is a sequencing problem. There are certain rules, and we can certainly talk more about this if you're interested, Brian, but there are certain rules associated with budget reconciliation packages that limit what you can do on them. And sometimes it's very difficult to obviously put money to new programs or new policies without already having an authorization. So since the USICA package is likely to take a back seat here for the next couple of months, we've got a situation where they're trying to put funds into agencies like NSF, like Department of Commerce, like the NIST programs in manufacturing, that have to rely on existing authorities. So some of the new things that they want to do have to kind of find a home with some existing authorities. And that's creating some challenges for the committees of jurisdiction, but nothing that they're trying to work out and trying to work through. All of which is to say, kind of back to your main point, there's a lot of interest in doing this kind of commercialization, innovation type of work. I do think they will find ways to fund this through various packages, as well as authorize some new programs and authorities over the course of the year.
Yeah, I mean, one thing my AURP members, and I think they'll talk about it tomorrow in the session about real estate is, the EDA has right now a $1 billion package called Build Back Better to create hubs. That money is already there. It's not authorization, it's been appropriated. And so, 20 to 30 regions across the country are going to get between $25 million to $100 million in different technologies, but my guess is a lot's going to be in the biotech area. And so that's exciting because, we know that money's there, and that competition, at least the planning grants are due, I think, October 19th. So I suspect some of the folks listening to this session are involved with applying for those EDA grants. Leslie, can you talk quickly about the budget? Are we going to have a budget? Because obviously we're coming up at the end of the federal fiscal year. What are we going to have a continuing resolution? Is Matt and Justin going to be able to go to work because they're federal employees? What do you see happening on the budget side?
Yes, and I'm happy to talk about that. I do want to kind of dovetail with what you're saying about EDA. It must be a very exciting time to be at EDA. The president's budget request, as well as Congress, even with some of the COVID relief packages, have put a great deal of money into EDA, really trying to jumpstart this idea of these technology regional hubs and that kind of thing. So there's a lot of fast and furious things happening at EDA, and the scale of which hasn't been seen in I don't know, ever. So yeah, I think you're only going to see more of that over the next 6 months to a year. But to answer your question, yes, we're going to have a continuing resolution. No one's quite sure how long it's going to last at this point, likely after the Thanksgiving holiday. So into December, we don't have a date yet, but that's the likely scenario. The challenge here is that we also are running up against a debt limit increase, and Congress is talking about attaching a debt limit increase to the continuing resolution. That's going to make it a little bit trickier. We are dealing with a Congress that is incredibly not only divided, but close in terms of numbers. If you just think about it, we're in a really unprecedented situation. We've got a 50-50 split in the Senate. The Democrats have a 4-seat majority in the House. Anything that involves raising the debt limit, major pieces of legislation with lots of spending are just going to be tough. In this environment. So I don't think you should expect things to happen quickly or easily. So I do believe that we will not, hopefully, shut the government down come October 1, but it could be a situation where it's going to get really ugly for a couple weeks before this gets over the finish line, and expect to see a lot of back and forth.
Great. So this question is for the entire panel. So, this is the BioHealth Capital Region Forum, and I know, Leslie, you have clients all across the United States. Matt and Justin, you guys represent organizations that have a national footprint. So you're not restricted to the BioHealth Capital Region, but BARDA, for example, you have an office now at Children's National, and obviously, Matt, you're in Bethesda. What advice would you have to businesses, regional leaders to organize themselves to take better advantage of some of these funding opportunities? Any advice to folks in the audience of what we should be doing collectively as a region to respond to these various opportunities? Matt or Justin?
Sure, I can jump in and say a few words. So our mission at NIH is of course broadly distributed across the United States, but just in Maryland, there's actually right now there's over 95 companies that have active SBIR or STTR funding from NIH. And one of the most attractive things about that funding is the fact that Maryland provides the opportunity to provide some state level matching funds for that NIH investment. And I think that concept of leveraging and bringing together the resources from the federal government, from resources from state and local governments is really critical. Another example of that is in those centers and hubs that we fund across the nation, For each one of those centers and hubs, we require matching funds from a non-federal source. So not only does that provide additional money to support research and development, but it really brings those local partners into the process and creates a robust local ecosystem that brings together all of the industry expertise and local product development expertise together with the federal resources. And I think that's going to become increasingly common and increasingly important. Even though there's lots of federal investment going on, it's a long road from basic science to getting products into the hands of patients. And I think there's an increasing understanding of the role for local ecosystems and leveraging the federal investments.
Yeah, and I'll just add on to what Matt said. I think, from BARDA's standpoint, just to clarify, we do non-dilutive and dilutive financing. So a lot of the partners that we have in the DMV region specifically are either large biotechs or pharmaceutical companies such as Novavax, GSK, here in Rockville, as well as some of the other smaller biotechs as well. So what I see, from being a Maryland boy, if you will, went to Montgomery County Public Schools, went to University of Maryland, and stay now work here in the DC region, is that we need to have a little bit better convening functions that separate this area from, for example, Boston as well as San Francisco. And that is, we have the federal funding, we have the academics. Right now, the private investments, keeping companies within the region from private investors and venture capitalists, I think is something that's very important. As you know, a lot of the brain drain happens because of technologies getting tech transferred out and then moving to different regions across the country. So, it's something that I think about a lot, which is like, how do we jumpstart the ecosystem, which is already here, everything exists, but how do we continue to maintain and grow the smaller businesses that are in our area, which is life science and biotechnology?
Yeah, it's interesting because, I see, as like you guys, I represent a national association, but we have, Research Triangle Park is well known internationally, but people don't understand the scale. So the distance from Johns Hopkins to College Park is about the distance between NC State and Duke. It's about the same distance. And they are marketed as a single place, but Baltimore sort of has its own ecosystem. DC, College Park is closer to DC, and it seems like there's a huge gulf. But in fact, we have the steak, but not the sizzle. And Research Triangle Park doesn't have that issue. So anyway, it's kind of interesting. Leslie,
I might want to add one other point too, which is that obviously the region is rich in all of the things that you mentioned, but it also, I think, has some things going forward that Congress is looking for and will certainly shape their policies, which is there's also a great disparity within the populations in the DMV region. And Congress is not only looking for innovation, to challenge China and as the USICA outlines here, but also they're looking to make sure that innovation reaches all aspects of the American society. And so they're putting a lot of parameters around the policies focused on involving previous groups that maybe have not been as involved, even in the biotech world as well, but also other types of universities and nonprofits, workforce development, again, focused on bringing everybody into this ecosystem and ensuring that any innovation that is created has the broadest possible reach. So I would say to your folks in the DMV region, really do have that as an important element or component in your organizational meetings and thoughts and planning, because I think that's going to be critical for these agencies moving forward.
No, you're absolutely right. If you read the funding notices of funding opportunities, diversity, equity, and inclusion is built in. So we've with Howard here, community colleges. We have Montgomery County Community College is an AURP member because they have an innovation incubator, and it is bringing a different set of students and faculty involved that haven't traditionally been involved with research parks or technology hubs. So I think you make an absolutely perfect point with the rich set of HBCUs and community colleges. This is something we have to do as a region, as a nation, around the world, actually. But thank you for bringing that up. I think we're getting a little close to our conclusion. Any comments, final comments, Justin, Matt? As Leslie said, this is an exciting time if you're an economic development planner, because there's a lot of money out there. There's a lot of opportunity. And what we've seen with the development of the COVID-19 vaccines, it certainly gives everyone hope for the future, not just with pandemic responses, but all kinds of research into all sorts of health therapies. And Matt, what do you see? What's NIH going to be focused on besides pandemic response in the upcoming years?
Well, I think it's become pretty clear that there's an increasing understanding of this continuous R&D pipeline that goes all the way from basic science through translational research, clinical research, product development, implementation, and dissemination. And I think what we're likely to see is more of a focus on the handoffs between those different parts of the innovation ecosystem. So, many people think of NIH as a basic funding agency, but our mission is actually not just to increase basic knowledge, but to apply that to affect human health. And with the COVID epidemic and all the great work that's been done by all the federal agencies, BARDA, NIH, DOD, CDC, I think there's going to be a lot more attention to the handoffs between these different stages and in increasing the collaboration between government and private sector.
And Justin, what's on the horizon for BARDA?
Yeah, I think BARDA, for us, we are a pandemic preparedness and health security focused agency looking at, medical countermeasures as a solution. So looking at this post kind of recovery, preparedness phase of the cycle, I think that the idea that the next pandemic is just around the corner is always comes to mind. In 2016, I gave a talk in California, and I said that there would be a new novel strain at the time of pandemic influenza, which we needed to be prepared for. And looking forward, I think the whole idea of platform-based technologies that can be applied through plug and play with sequences to create vaccines, therapies, as well as diagnostics and devices, I think is going to be important, especially working across the interagency. And then the other topic of domestic capacity expansion is very important as well, that Leslie, as well as Matt alluded to, which is, how do we continue to maintain, or how do we bring back, if you will, the manufacturing capability that we've lost over the last 2 decades back to the United States, such that in the event of a pandemic, when borders shut down, we have the capability and the ability to respond when critical components and raw materials are not currently made in the United States, especially for these life-saving therapies.
Yes, I know a lot of jurisdictions in the DMV are looking at biomanufacturing. There's a lot of new sources for funding from the federal government that you're seeing out of NIST and out of potentially NSF and Commerce. So I think you're right, biomanufacturing, repatriating some of those tools and production to the US and to this region is really critical. So Leslie, I want to go back to you for just sort of kind of closing comments. So, there's been, I think, bipartisan agreement on, funding for more R&D. So far, it's lasted. Do you think that's going to continue? I mean, there seems to be a lot of strings in Congress. Do you think that the enthusiasm for increasing the R&D budgets is going to continue, even if we were in a more challenging economic climate? And who knows where we will be a year from now?
Sure. Thank you for that question. I would say in respect to, or with respect to medical, biomedical type of funding, I see that this will continue to have growth in a bipartisan way. Whether the Republicans, take over the House after next year's election, or there's changes in the Senate, or even the next administration. Obviously, I think this pandemic, as Justin and Matt were alluding to, has certainly caused a lot of the general public, and therefore the members of Congress that represent the general public, to want to really focus a lot of attention on how do we prepare for the next pandemic? How do we do a better job with medical research, biomedical research, medical technologies, things of that nature. And I don't see that really going down over the next few years. NIH has been on a very positive trajectory over the last 8 years, and I don't see that it's going to diminish. I do think, though, that overall spending. I mean, I know that we are looking at some pretty unprecedented budget bills here that we haven't seen really ever. And so I do think that some of that will throttle down. You can only sustain this for so long. But I don't necessarily think that that's going to hit hard on biomedical research. There may be a few other areas that take a hit more.
Yeah, well, great. So this is an exciting time to be in the DMV. I think you're seeing more cooperation, between or among, Maryland, DC, and Virginia. I think the BioHealth Capital Region Forum has been kind of instrumental in getting us to think more regionally. And I think with the presence of BARDA, with the presence of NIH, with NSF, having a new science and technology directorate, likely that's just going to rebound to the benefit of Maryland, Virginia, and DC. So I want to thank Justin, Matt, and Leslie for a great panel discussion. If you do have questions, hopefully you can put them in the chat, and we can then answer them offline. But it's great to have you all here. And I want to mention that I have a slide coming up here. I want to mention that if we can get my slide up, that AURP is holding its international conference October 19th to the 21st at Salt Lake City, hosted by the University of Utah Research Park. We have several tracks discussing life science R&D and wet lab construction and tours of new bioconstruction. Leslie Gilbert will be speaking as well in the latest updates from White House and Congress. We have a panel, and hopefully with an EDA rep. We mentioned the $1 billion Build Back Better program. The EDA rep will be updating us on that, and Leslie will be updating us on what's happening in Congress and the White House in October. And my guess is we're going to hear a lot of new and great ideas coming out of Congress. And then if we move to the next slide, I wanted to mention, I mentioned the BioHealth Caucus that Rich Bendis co-chairs with one of our representatives from AURP from the University of California in Sacramento. We will be holding our BioHealth Caucus June 12th to the 13th in 2022. We hold this right before the Bio Conference, which is taking place in San Diego, California. And our focus is really on where do you build the facilities for these biotech companies that Matt and Justin are helping fund. Who's responsible for building those facilities? What do they look like? How are they designed to create collaboration? So we'll be meeting June 13th to the 12th to the 13th, 2022 in San Diego, right before Bio opens. With that, the advertisements are over. I want to again thank my panelists, Justin, Matt, and Leslie for a great discussion. And I hope everyone has stay tuned for other panels coming up after ours. Thank you all.